We are back. Journey to 600. Today we're going to be talking about traction, cervical and lumbar traction. So what are the cervical traction indications? There's 5 of them, and if you have 3 or more, that's going to be a 79.2% probability of success. 4 or more has 94.8% probability of success. But other clinical signs that traction should be tried includes radiating upper extremity symptoms, positive Sperling's maneuver, and any other neurological signs. But those 5 that we're kind of looking for is that the patient reported peripheralization with lower C-spine mobility testing, a positive shoulder abduction test or Picotti sign, their age is greater than 55, they have a positive upper limb tension test, bias for the median, or they also have a positive neck distraction test. So cervical traction parameters, typically the patient is going to be supine for cervical, and depending on what cervical spine you're targeting, you're going to vary the degrees of flexion. You might use an extended position for disc issues. Talking more about those parameters for cervical traction, looking at static versus intermittent. So you would use static for more of inflamed or symptoms aggravated with motion. Intermittent would be more symptoms related to disc protrusion, muscle spasm, or joint dysfunction. Intermittent traction may be more effective for reducing pain and increasing cervical range of motion. Looking at on and off times, so a long hold time would be more for disc protrusion and soft tissue stretch with a ratio of 3:1. A short hold time would be more for joint dysfunction and muscle spasm, doing more of a 1:1 ratio. Now talking about the force for cervical traction, you're going to use 7 to 10% of their body weight for disc protrusion, soft tissue stretch, and muscle spasm. And then you will increase the percent body weight for more of a joint distraction, so 13 to 20% of their body weight. You would not want to exceed 10 pounds for that initial session, and you do not want to exceed 30 pounds in general. Between sessions, you might progress by 3 to 5 pounds. Treatment duration. Initial treatment would be 5 to 10 minutes, but you could treat up to 30 minutes. Disc-related issues are typically around 10 minutes, but other pathologies could be up to 30 minutes of treatment. Now for lumbar traction indications. Number 1, lower extremity radiculopathy symptoms. Number 2, signs and symptoms of nerve root compression, which include things like sensory deficits and strength deficits. Number 3, peripheralization with extension movements. And number 4, positive cross straight leg raise. The patient position for lumbar traction is typically supine for facet issues or stenosis, prone for disc issues. Prone for disc issues is due to more of an extended spine, and typically patients with disc issues like to be in extended positions as that relieves their pain. For facet issues and stenosis, they typically like more flexed positions due to the gapping between the vertebrae. Static versus intermittent. Static you're going to use if symptoms are exaggerated by movement. Intermittent will be for joint mobilization or for those who cannot tolerate that static traction. Lumbar traction parameters, the force. So you're going to use 25% of body weight for soft tissue stretch, muscle spasm, and disc protrusion. You're going to use 50% of body weight for joint distraction. That was similar to the cervical spine, where you're going to use more percent of their body weight for that joint distraction. You need at least a minimum of 25% of their body weight to overcome friction, but you do not want to go over 30 pounds for that initial session. Treatment duration. Initial treatment will be for 5 to 10 minutes, and typically that's some disc-related issues, but other pathologies could be up to 30 minutes of treatment. What are traction contraindications? So that would be subluxation or dislocation, fracture, osteoporosis, positive alar ligament test, so that is a cervical instability test. If they have a positive alar ligament test, we're not going to do cervical traction, pregnancy, tumors, vascular conditions, and vertebral joint instability. Practice question number 1. A physical therapist treats a patient with mechanical lumbar traction in the prone position. This position would be most appropriate for treatment for a patient with which of the following diagnoses? A. Spinal stenosis, B. Osteoporosis, C. Spondylolisthesis, D. Disc protrusion. I'll give you a moment to answer. Please pause if you're not ready to review. So the patient is prone, that means they're in a more extended position. Which of the following diagnosis is most likely to benefit from this treatment? Well, spinal stenosis is a condition in which the spinal canal narrows and compresses the spinal cord and nerves. The condition is best treated with the patient in flexion since this position maximizes opening of the intervertebral foramen. Osteoporosis is when the rate of bone resorption increases and the rate of bone formation decreases. This is typically a contraindication for lumbar traction. Spondylolisthesis, forward slippage of the vertebral body. Traction can reduce neurodeficits from this slippage, but the patient position is variable when treating spondylolisthesis. Disc protrusion is most common in the posterior lateral direction. Prone positioning facilitates spinal extension and directs forces on the disc anteriorly. So D, disc protrusion, is the best answer for this question. Practice question number 2. A patient reports back pain that decreases with spinal extension. They reported their MRI shows disc herniation at L3. Which of the following parameters would be the most effective protocol? A, force 10% of body weight for 10 minutes. B, force 15% of body weight for 30 minutes. C, force 25% of body weight for 10 minutes. D, force 50% of body weight for 30 minutes. I'll give you a moment to answer. Please pause if you're not ready to review. So A, 10% of body weight for 10 minutes would be for more disc protrusion for cervical traction because of that lower body weight. 15% would be for cervical traction for more of a joint distraction, not disc herniation or protrusion. 25% of body weight is for disc as well as the 10-minute time mark. So C is the best answer. Force of 50% of body weight for 30 minutes is going to be more for a lumbar joint distraction. So remember, that distraction is going to be that larger percent body weight. And you want to at least do 25% body weight for that lumbar spine. So knowing in this question that they have a disc herniation at L3, you're really only narrowing it down to C and D anyways. A and B are for more cervical traction. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.